Hey guys, we're going to finish up our chapter 4 on the histology. We're going to hit the connective tissues. A lot of you guys have already had this in lab. I know my lab class has. And as I told you, it's probably the most complicated of the tissues. It's kind of important. It's the most abundant tissue in the body. And a lot of it is non-living substances. And we'll talk about this in a lot more detail than we did in the lab. So the connective tissue is going to hold things together. These guys hold our bones together, hold our muscles to our bones, support underneath the layers of our epidermis and dermis. We have this. In other words, under the skin, it holds it on. And it gives us strength for other body tissues. And we'll talk more about that as we get along. It protects and insulates organs and stores fuel. By fuel, we mean like calories. Fat tissue is a connective tissue, adipose. So that's where they're talking about protects. Yes, our kidneys are wrapped in adipose tissue. And insulation, it kind of keeps us warm. That's why. And it also helps us to put certain structures in compartments like the muscles. But in any case, we'll talk more about that. So there's 4 main subdivisions of connective tissue. The connective tissue proper, which is going to be loose and dense, is its subdivisions. Cartilage, there's 3. Bone and blood, there's bone, there's 2. There's spongy bone and compact bone. And then blood is just kind of all by itself. So let's go to the next slide. All connective tissue has 3 parts. They have the cells. Now, unlike epithelial cells, which was all about the cells, and these cells coming together and forming these big sheets, these guys are more about the space in between the cells. So we do have cells there, and we have fibers. There's 3 fiber types. There's collagen, elastic, and hold on guys, let me think. I had this same problem in lab today. Collagen, reticular. I don't know why. I must have a mental block on that. But those are the 3 fiber types. Ground substance is kind of what the connective tissue, it's part of what it's there for. It's hard to say. Let me give you some examples. Now, fibers and ground substance together is called the matrix. So the matrix of bone is going to be, there's collagen fibers, and over the top of that, there are crystals of calcium and phosphate. And those guys are the matrix. For some connective tissue, the ground substance is water. So they have different matrices or ground substances, and I'll tell you about that as we go along. These guys all come from the same embryological tissue. They come from mesenchyme. Not unlike the epithelial. I told you that epithelial tissue had very poor blood supply. They were totally avascular. These guys, the blood supply varies. Some have really good blood supplies and some have very poor blood supplies. And as we said already, the cells are actually kind of spaced out, and the matrix is consisting of things which are actually non-living. Fibers aren't alive. They're not a cell. And whatever fluid, whatever it is, they have this space. And we'll see this in the specific examples, guys. Okay. Mesenchyme is the type that it came from. These guys don't have polarity. But these guys, you get the cells and they're surrounded by fibers and whatever the ground substance happens to be. Let's just run over here. Cartilage is avascular. Cartilage, we'll talk about that. That means that when it's torn, it takes a long time to heal because there's not a good blood supply to bring the repair crew there. Dense connective tissue has some, but they're generally poorly vascularized. And again, it takes a long time for these guys to heal. Bone, on the other hand, has a great blood supply, and you break your bone in about 6 weeks. You know, most of the time, if it's a simple fracture, your bones are going to knit back together. So it depends on that. We'll talk about that. The ground substance could be fluid, the extracellular or interstitial fluid. Some types of proteins, like those proteoglycans, can be there. Polysaccharides, chondroitin sulfate, hyaluronic acid are two that you see a lot. Some of these guys have water kind of trapped in between them, like the cartilage, but we'll get to that, guys, in the specifics. So we talked about these guys. Collagen, they're biggest, strongest, and they're the type we have the most of. When they talk about tensile strength, they mean that you pull this way, they're very strong. So it's hard to pull these guys apart. Elastic tissues are kind of like wavy and they stretch. That's why they're called elastic, right? And they rebound, just like if you stretched a rubber band and let go of it, it would snap back. Reticular is kind of a net-like thing. Now, they're not exactly a net with everything at 90 degrees, but they are similar to a net. A lot of collagen fibers, kind of short, but we'll get into that too. Okay, make sure I don't turn off my record, because that's a pain. I have to start over. Okay, the cells that make the fibers, and that's what the connective tissue cells do. They make fibers for the most part. Blood is an exception. We call those guys blasts because they make them. They can also do divisions. Now, when they're finished, when they no longer make the fibers and no longer divide, then they change from blastocytes. In the bone, well, let's see. Oh, well, they got it down here. Fibroblast in connective tissue proper, that type of, these guys make fibers, and they pretty much will always stay blast. You have chondroblast in cartilage. They make the fibers for the cartilage, and once they're finished, once they're surrounded, they're kind of like painted into a corner, then they change into a chondrocyte. Same thing with bone. The bone chondroblast or osteoblast are going to make collagen, which is later going to be coated with a hard crystal, which is what bone is. But eventually they're going to find themselves surrounded by this matrix, and at that point they change from a osteoblast to an osteocyte. The adipose cells, the white cells, mast cells, macrophages, they don't, well, I mean, we do have blast in there. That'll be an AMP2 topic, so let's kind of gloss over that one. Oh, I am in the way. Now, this is supposed to be just a general picture. This is not supposed to be any specific kind, but really it looks a lot like a loose connective tissue called a relar. I'll show you a picture of that. So you see the fiber types. There's the collagen fibers. These guys are whopping big. The elastic fibers a little bit more, and then the reticular fibers are very small. There is a fibroblast. These are the guys that make these fibers. These fibers are made out of protein. They just have a big rough ER. There's a lymphocyte. That and the macrophages are defense cells, but they do hang out. The mast cell is also a cell that causes us to have inflammation. Neutrophil is a defense cell. Those adipocytes, they just store fat. Now you do have fat scattered, but a lot of times it's kind of clustered together in the tissue, and we'll see that coming up. Okay, now I think I'm still in the way. Let me come over here. So there's collagen. You get a procollagen subunit, and these guys, 3 of them, twist around each other and become a collagen fibril, and all of these fibrils together make up the collagen fiber. Very thick, very strong. You may have seen a big rope at some point, either like in your PE classes or wherever, and you notice that a lot of times these guys are made up of smaller cords that are wrapped around each other to give it extra strength. It's a similar situation. Now here's those elastic fibers. I'm telling you that they're kind of, oh, I'm in the way again. There we go. This is where they are when they're relaxed, and they can stretch, which takes those things and just kind of elongates them, but then they'll rebound right back. We'll talk about where we find those, as different tissues have them. There's a cartilage that has it, and then there's one tissue that's just elastic. But we'll talk about that but in just a second. Okay. Let me just pause the recording for just a second. Okay, guys, sorry about that. So the reticular fibers, I am still in the way. Okay, there we go. As I said, they're kind of a net-like tissue. Or fibers rather. You can see how these guys connect at, angles, and they form kind of a net. This is a type of collagen. These guys are thinner, of course. We saw that in the other thing. And these guys are going to be almost like a kind of a soft skeleton around things like a liver, your lymph nodes, and your spleen. They provide support for capillaries and nerves and muscle cells as well. So that's pretty good. See if I can bring myself out of here. I don't know. Yeah, I guess I better. Okay, self, you go right there. Okay, now this is a good little diagram, guys, to try to help you keep straight what's going on here. Connective tissue, proper and specialized connective tissue. We usually go over the proper first. We usually start at this left end and go across, excuse me. So the connective tissue proper, I already told you, we have loose and we have dense. The loose connective tissue comes in 3 flavors. There's the areolar, there's the adipose, which we've already kind of mentioned, and then there's reticular tissue, which is made up mostly of reticular fibers, which kind of makes sense if you think about it. Then we have the dense connective tissue proper, and we have dense regular, dense irregular, and then elastic dense connective tissue. Now the specialized tissue, we've got blood, as I told you. It's just kind of in its own category. Bone comes in two forms, spongy and compact, and they're really easy to see. Cartilage comes in 3 forms. There's elastic cartilage, there's hyaline cartilage, which is the most common type, and then there's fibrocartilage. And we're going to get into each of these guys coming up in just a moment, guys. The loose connective tissue we've already talked about. And of course, the fibers are going to be produced by the fibroblast. That's so simple. Okay, here is one. Let me move me again. I told you we were going to look at areolar loose connective tissue. If you look there, I don't know if you can see those pink. Those are the collagen fibers. Humongous. These darker fibers are going to be the elastic, and then those very light fibers are going to be our reticular. Now this guy, I told my lab class the one thing you can say about this guy is it's mostly empty space. You've got fibroblasts there, that's the cell type. The fibers, you've got all three types of fibers, and then the ground substance is just tissue fluid. This is in the first part of the dermis that's underneath the epidermis in our skin. It's vitally needed. It provides a place for us to have inflammation. And inflammation is really important. We'll get to it later in the semester. We need for things to become inflamed in order to fix them, in order to stop the bad guys from giving us an infection. Okay, and of course, we already saw the macrophages, the neutrophils, all these other guys were hanging out here too. Wraps and cushions organs, macrophages is there to protect us. And I already told you about the inflammation. This guy is underneath a lot of our epithelial tissues. The basement membrane, which we talked about in the last video, this is going to be a big part of it. Now, there's another connective tissue underneath this, but this guy, like I say, this is where the blood vessels are that nourish the epithelium in the skin. So, hopefully, that's going to be a relar connective tissue. This is adipocyte, or excuse me, these are adipocytes. This is adipose connective tissue. It looks a lot, I know, like simple squamous epithelium. It's not. Simple squamous epithelium is a ring made up of multiple cells. That's just one cell right there. There's the nucleus right there. He's pushed to the side. You know what this guy essentially is? An oil tank. That's what he does. He stores oil. The oil that he stores is triglycerides. That's where we put our extra calories because, you know, we don't waste calories if we can help it. We don't, which unfortunately, because that helps us to gain weight. Matrix is the same as in the areolar. It's just this tissue fluid. But there's not as much because these guys are kind of packed, almost like an epithelial cell. The nucleus is pushed to the side. This is insulation. It does. People who have very little body fat are the ones who are going to be turning up the thermostat. People who have a lot of it are the ones who are going to be turning it down. And some of the rest of us in the middle are going to, we just go either way. But this also provides us a cushioning for like the kidneys, and the heart has a lot of this around it too. We've got this under our skin for the subcutaneous tissue, the kidneys, behind the eyeballs, and in females, 90% of the breast is adipose tissue. The breast is essentially a bag of fat. Okay, guys. Next type is the reticular connective tissue, and this is going to be the end of the loose connective tissues that we have. We kind of already saw this. This guy is going to have reticular fibers. Now these look bigger because of they're magnified at a higher power. The loose connective or the ground substance again is just tissue fluid. The cells are the fibroblast, and these guys, like we were saying, they're in a soft skeleton for a lot of organs. That's, by the way, it's called a stroma. We already talked about the location and the bone marrow, the lymph nodes, spleen, liver. That's where you're going to find these guys. Pretty reasonable. I mean, you may think of that as more like a branching tree than a net. You know, whatever helps you with that. But that's the end of the loose connective tissues. So now we go to our dense connective tissues. These guys are not going to have a lot of cells. They're going to have a lot of fibers. Matter of fact, if you remember, the epithelial cell was a bunch of cells connected together. These guys are going to be a bunch of fibers that are connected and very close to each other. As far as running in the same direction, that depends on which type. Few cells, not a lot of good blood supply, which means that when it gets damaged, it takes a little longer to heal. Fibroblast, again, is the cell type. Got a lot of great strength. Three kinds: dense regular, dense irregular, and elastic. So there's our dense regular. Wow, that looks like smooth muscle. Yeah, now that one especially looks kind of bad because I see a lot of nuclei. Usually when you look at this, what you're going to see is very few nuclei, and they're going to be kind of cigar shaped, a lot thinner than the ones in smooth muscle. In addition to which, all this pink staining stuff you see is collagen fibers. They're all running in the same direction like this, and that means that they're very strong this way, but very easy to pull out that way. This is what our tendons, which anchor the muscles to the bones, the ligaments, which anchor the bones to the bones, are made of. Very strong, but only in one direction. Aponeurosis is like that. Well, we'll get to that. Let's just wait till we get to the muscles and I'll tell you about that. That's down the road. Okay, so here is dense irregular. You see the fibroblast. These guys are going to have those same collagen fibers, except instead of running like this, these guys are going to run in every conceivable direction. And that means that this guy has strength against pulling in every direction that you can think of. That's what anchors the top part of our skin and the areola or loose connective tissue to the rest of the body. Very strong fibroblast. Around the liver and the spleen, we have this very tough, it's on the outside. I know we still have the elastic tissue on the inside as the skeleton, but this is around there in the dermis of the skin. We'll talk more about that when we get to the skin, which is next. Okay, and then the last type of connective tissue and dense connective tissue is the elastic. These guys look like a bunch of squiggly lines, which when they are stretched, flatten out. The main cell, and it's hard to even see a cell in there. There's a nuclei right there. I think there's one right there and right there. Those are fibroblasts. These guys have got a lot of elastic fibers running in the same direction. Now, the reason I told you a minute ago that we're not going to define dense connective tissue by having fibers running in the same direction is because of the dense irregular connective tissues. These guys are going to allow things to stretch and then come back. The big artery that comes out of the heart, when the heart is actually squeezing, it's going to expand. When the heart goes into its rest phase, it's going to rebound. We'll talk more about that in AMP2. I'm just giving you some ideas where you find those. The bronchial tubes have these too. Those are the airways. Again, AMP2 topic. Okay, guys, that's all the connective tissue proper. Now, cartilage types. Hyaline, elastic, and fibrocartilage. A lot of people are going to mix up elastic cartilage and elastic tissue. They don't look anything alike, seriously. Cartilage is going to be easy to tell because they have a cell. You see the nucleus, and it sits in a very shallow bowl, and that's exactly what it is, a shallow bowl that is called a lacuna. Lacunae is the plural. So it's real easy to see, and I'll show them to you as we come up there. This guy is good. It not only can be stretched, it can be compressed, and it kind of bounces back. There's some fluid in there inside the ground substance. You've got this. What can I say? Oh, as far as fibers, they have fibers, and obviously elastic cartilage is going to be predominantly elastic. Fibrocartilage is going to be predominantly collagen, and hyaline is going to have a little bit of all of them, but you're not going to be able to see them in the photographs. No nerve fibers, and totally avascular, just like epithelial tissue. So that means that it's going to take a long time for these guys to repair. It gets diffusion from other connective tissues. There's a membrane surrounding it called the perichondrium, and in there we have the blood vessels and so forth. Okay, cell types, the chondroblasts and the chondrocytes. We talked about that. Chondroblasts make fibers. Chondrocytes are kind of already in a lacunae, and they're surrounded by the matrix, so they really can't do anything. They maintain it, but they don't actually actively secrete. So here's hyaline cartilage. It's the most common type. If you look, you can see, and this is a great picture because it's real close up. There's the nucleus and the cell, and that one area right there you see is actually that little shallow bow, the lacuna. All the cartilage is going to look like this. The cell is going to be in a lacuna. That's your key, guys. Amorphous means not kind of shapeless, but it's kind of firm. The collagen fibers are there, but you can't see them. The chondroblasts, which are not in the lacunae, are making them if it's actively growing, and the chondrocytes are just going to maintain it. This is support and reinforcement. It acts as a cushion between our thigh bone and our lower bones in our knee joint. We have cartilage pads that the thigh bone sits on. Now we got cartilage on the ends of all the bones to keep them from rubbing against each other, but this special cartilage pads help to transfer the weight without having any real difficulties. A lot of weight on the knee joints. That's why we get a lot of folks that have surgeries on there. And I'm sure you have seen cartilage. If you have ever had fried chicken or a turkey leg, you have seen on the end of that leg that little white substance. That's hyaline cartilage. We've got the same stuff. Cartilage, you get it on the bottom of all your joints, and over time it wears out, just like, again, like a brake pad. Unfortunately, it doesn't fix itself and it doesn't repair itself. That's what's known as wear and tear arthritis or osteoarthritis. It's just the wearing away of the cartilage. Now, usually this takes decades to occur, but if you overuse your body or abuse it, you can wear it out a lot faster. But a lot of folks get knee replacements because the cartilage is worn, and when bone starts rubbing on bone, a lot of bad things happen. What else can I tell you? The skeleton in the baby prior to birth is going to start out as cartilage, and then we're going to change it from cartilage to bone, which is not really hard. The cartilage actually kind of is the model, and then the bone just goes and replaces the cartilage, and we're already in the right shape. The ends between the ribs and the sternum or the breastbone, we've got this cartilage that connects them. Cartilage is a little bit more flexible and has a little bit more give than bone. So this part of our nose, you know that the bone part of the nose ends up here on the bridge, Everything down below there is cartilage. Okay. There is elastic cartilage. You can see the fibers in between, but what you still see is you still see the chondrocytes and the lacunae. That doesn't look anything like the elastic tissue that we looked at, guys. It is totally different. It doesn't look like hyaline cartilage, which is one of the most common mistakes folks make on a test. They call it hyaline. I can see these fibers. It can only be external cartilage. And that's what your external ear here is made of. That's why you can bend your ear and it snaps back, because it's made of this cartilage. The cartilage gives it a little bit more shape, and the elastic gives it that rebound ability. And then there's another thing, the epiglottis, but that's an AMP2 topic, so we'll defer to that. Here's the last type of cartilage, fibrocartilage. Now, this one stains purple and blue, but don't get mistaken. You can see these guys that are completely pink. They look a lot like dense regular connective tissue. They look a lot like the smooth muscle. How can I tell them apart? There is the cells in the lacunae. That's it. All cartilage has cells that live in these little shallow bows called lacunae. These guys are going to have a lot of good cushioning ability. These are between your vertebrae. The disc that folks get slipped, this is the disc that gets slipped. Those that I was telling you about on the knee joint are also fibrocartilage. Those are collagen fibers. Okay. That takes care, that takes care of the cartilages. Let's talk about the bone. Osseous tissue, you got collagen fibers, you got salts of calcium and phosphate called hydroxyapatite that coat it and make it hard. The fibers in our bone make it so that it can bend without snapping. And then the hardness gives it strength. You need both of those because your bones get subject to pressure, and if it were just solid, hard materials, it would be very brittle and they would crack easily. But the collagen gives it the ability to stretch just a tiny bit. Now these guys have got osteoblasts that make it, and then we've got the osteocytes that are going to maintain it. These guys come in two forms, spongy bone and compact bone. I don't think I can do anything. If you look right there on the inside, that's the spongy bone. And then around it, surrounding it, is the compact bone. It's kind of like the wall of the bone. And on the inside, you have that spongy bone, which have these spicules, these struts, that are bracing the bone in different directions. The reason we don't have just solid compact bone is because, number one, it would be too heavy. The heavier we are, the more calories it takes to keep us alive. That was a big thing for survival. Number two, that's where the bone marrow is. That's where we make our blood cells and other things. So there's a reason behind this. Plus, here's probably the biggest reason. We change the direction of those. I'm drawing a blank. Hang on, guys. Well, in any case, we'll talk more about that when we get to the bones. But we change the direction so when we start doing something that we don't normally do, so we actually, they call it remodeling, we change our bones. So if you start a new job where you're moving in a different direction than you were, your bones are going to customize themselves to be strong in the direction you're using it. Okay, here's the compact bone. This guy is a piece of cake. So this is the outer. That is not a big cell right there, guys. Everybody mistakes that. What in the world is that? That's a hole. In that hole, we've got blood vessels and nerves, okay? That's called the central canal. We'll get to that when we get to the bones. Those are the cells right there, those little elongated black. Those are the osteocytes. This right here is the matrix, which is that calcified, hardened collagen fibers. This guy is well vascularized, and we know, we'll talk more about the bones location or the function of it when we get to the bones chapter. This guy is super easy. Nothing else looks like it. It looks like a tree trunk that's been cut. And you can see the growth rings, and those growth rings are actually growth rings, just like they are in trees. Here's some spongy bone. You can see the these are not chondrocytes. You can see the osteocytes in their lacunae. You might have a little bit of a problem. Oh, trabecula. That's what I was trying to think of. Differentiating this from a chondro or cartilage tissue. But these struts, or these little areas that we put these braces up, you don't see that in cartilage. And we already talked about what it does and why we have it. It does lighten our bones up without sacrificing strength. And there's blood. Blood, the matrix is the plasma, which is just basically water with some other stuff added in. The cells are going to be the red cells and the white blood cells, and these little specks right there that are platelets. Those are the guys that cause your blood to clot when you have a bleed. These guys are all within the blood vessels. Okay. This last two types are super easy, the muscles and the nervous tissue especially. Muscle tissue is kind of like epithelium. In order for them to work, they have to have a bunch of cells, and they all have to be together because they all pull together in order to move our body. These guys have got to have a good blood supply because they do a lot of work, and because of that they need a lot of ATP. So they have to have a good blood supply to bring them oxygen and glucose. We're going to talk more about this in the muscle chapter. I don't want to go into great detail. We'll talk about the myofilaments then. Okay, the three types of muscles: skeletal muscles, which is voluntary, things you can decide to move; cardiac, which is just your heart; and then smooth muscle. Those are the muscles that are in the walls of your blood vessels that cause your blood vessel, to constrict. They're also in the walls of your airways, which is when you get asthma, and inflamed, they constrict and cause problems. And in your GI tract, they squeeze and push things through. We'll look at these three kinds. Skeletal muscle, they are striped, which we call striations. You'll see light and dark stripes running vertically on this. Now, these muscle cells and skeletal muscles, it's kind of like dense regular, they all run alike. This is not a fiber, this is a cell. Now, these cells have more than one nucleus. But what I'm telling you, this guy is, we're going to talk about this after we get finished with the bones and the joints. But these guys are going to be straight, parallel, and they're going to be striped. These guys attach to bones and move them. Sometimes they're attached to skin, like for facial expressions like that. Of course, we got some muscles up here too, but sometimes we just do them to do that. And facial expression is a big part of communications. Here's cardiac muscle. They are striped, but if you notice, these guys branch. They're not just these straight things. These guys have come and they give off, sorry guys, they come like that and give off branches. These guys also have something called an intercalated disc. That's these guys right here. That's what joins the individual muscle cells together tightly. And there's also a gap junction in there to allow the ions to move. We talked about that a little bit in the cell thing. This guy is in the walls of the heart. The reason these guys are connected together is because we don't want them to pull apart. And the reason they have gap junctions is because they need to all squeeze at the same time to push the blood out. And then the last type is this. Oh man, that looks like dense regular. Well, these nuclei are not as thin or as cigar shaped. They're more like an elongated football. And the other thing about these guys is these are actually cells, but one thing you'll notice, there's way more nuclei, because those cells have to have a nuclei, but when it comes to a bunch of carbon or collagen fibers, we don't need that many, just need the nuclei for the fibroblast. Spindle shape, fusiform, torpedo, stretched out football, however you want to say it. No striations. These guys are kind of attached in sheets. These are going to be squeezing your bladder and moving things. These are not under voluntary control. These guys go based on their preset conditions. Like when a bladder gets so full, it's going to squeeze and empty regardless of anything else. Now these are the nervous tissue. There's a lot of supporting cells, those little nuclei there, and we'll talk about that when we get to that. Those are glia cells. But these guys are the neurons. The neurons you can tell because they've got these processes coming off of them, almost like star-shaped, some of them. These guys, nothing else in the body looks like it. These are the guys that make up your brain, that make up your spinal cord, that make up the nerves that go out and control your muscles, and the nerves that bring information like temperature and pressure and pain to your brain. They do this by electrical signaling. We're going to talk way more about that, guys, when we get there. Okay, body membrane classification. We've got 3 membranes. We've got the cutaneous membrane, which is basically the skin. The mucous membrane, which is the mucosa, like the inside of your mouth, the outer part of the, or the inner part of the anus, the vagina, places like that. We've got serous membranes, which are those guys that surround organs and also surround the cavity. And we're going to see those. Membranes, epithelium with connective tissue underneath it. It's either going to be a relar or irregular or what have you. Okay, cutaneous membrane, again, it's just your skin, guys. It's pretty easy. It's dry, it's very salty, it's kind of acidic, which is to keep bacteria from getting a foothold, and it's waterproof, which keeps our water in and keeps water from coming in. Of course, if you stay in the water for 2 weeks, it's going to make its way in regardless, but for casual showering and swims, it's okay. About 16% of the body weight is the largest organ, but we'll talk more about the skin in the next video. Mucous membrane, again, the mucosa, you think about what you have in the nose and in the mouth, the lining of the esophagus, and in the linings of the airways of the lungs. Line cavities that open to the outside, the reason they call them mucous membranes, they got little cells called goblet cells that make mucin, which when mucin hits water, it becomes mucus. We also have those in the GI tract too, the reproductive tract. In the respiratory tract, they're used to trap dust and bacteria to keep them from falling into our lungs, and then we move them out. In the GI tract, they're made to provide lubrication. If you've ever had something and you had a very dry mouth and throat, and you swallowed something, you notice that you got a little bit of a friction burn. The mucosa and the mucous membranes are there to keep that from happening, because it's very uncomfortable. You probably wouldn't want to eat if you got a burn every time you swallowed. Kind of takes the thrill away. Serous membrane, called serosa. We've got these guys. Now, it's hard to see on here, but basically what happens is around the heart, on the heart itself, we've got a sheet of this tissue, and it's called the visceral. You know, viscera means organ. So the viscera is the visceral pericardium is going to be on the heart, and then it's going to go up to the end of the heart, and then it's going to do a U-turn and come back and line the cavity, which is the parietal pericardium. And then there's a space. In actuality, it's more of a potential space, but it's got fluid, and it allows the heart to move without rubbing and maybe causing scarring that would keep it from moving. Same thing with the lungs. Each lung has its own separate, and it has parietal, the cavity, visceral on the lung, but we call these guys pleura. Finally, in the abdomen, we have this that lines, again, the abdominal cavity and the GI organs that are around them again, and we call these peritoneum, visceral and parietal. When you get to MP2, we'll talk more about it, but that doesn't actually go all the way back. It actually kind of closes off. We've got some things that we call retroperitoneal. They're behind it. Okay, tissue, the primary germ layers, ectoderm, mesoderm, and endoderm. These are formed pretty early in the baby's development, and these guys are going to eventually form those four main tissues. Nerve tissue is going to come from ectoderm. Muscle and connective tissue from mesoderm. I know it's going to become mesenchyme. And epithelial layers or epithelial tissues are going to come from all three of those. Here you can see the ectoderm is the blue, the pink is the mesoderm, and the yellow is the endoderm. Let's see, I think I got another one. Yeah, there it is. A little bit better. The epithelium coming from all three layers. The inner lining of the GI tract, that we talked about, is coming from the endoderm. Muscles, connective tissue, mostly mesoderms. Not a lot on that one, guys. Just need you to know the three germ layers. Now here's an important one. We're just about done. Oh, I'm running over on time. I'm sorry, guys, but I wanted to get finished. We just got 3 more slides. Tissue repair. How do we fix ourselves when we get cut or damaged or scraped or what have you? Well, we need cells to divide to make more cells, because more than likely we have some damaged and destroyed or whatever. We have to have cells move around, and then we got to have growth factors, hormones that are released by the injured cells. Sorry. Oh, I got a dry mouth. Sorry. But in any case, that's how we know the cells that are injured. When they rip open, they release these hormones, or they release these chemicals that let the repair crew know that we've got a problem. So we can fix this with 1 or 2 ways. We try to fix it by using the same kind of tissue to fix it with, but sometimes we just use fibers, and that causes scars. So inflammation, the chemicals are released, and as I told you, the mast cells actually release something called histamine. A lot of folks probably take antihistamines for allergies, but histamine is one that helps as a pro-inflammatory. The capillaries, I'm trying to get this straight, are going to open up and they're going to get really leaky. So you're going to get fluid that leaks out. You're going to get red cells that leak out. You're going to get platelets that leak out. And these guys are going to come and they're going to basically form a clot over the wound. That clot is liquidy, but it's going to turn into a gel, and eventually it gets hard, and that's what a scab is. And they've already talked about the clotting. Let's see this. So there's a blood clot. I can't even see that. Oh, there we go. Because of the damage, the cells have released the pro-inflammatory, and also we got the other guys. So the cells, the white blood cells, the defense cells, actually leave the blood and go into the tissue, because anytime your skin is compromised, there's the risk and probably almost certainty that bacteria are going to get in there. So we have our defense guys to go over there and try to stop them. The blood and the clots are going to form and kind of temporarily cover this. And when it dries, of course, it's that scab. Now, here's what's going to happen. We're going to change this. We're going to have something called granulation tissue, which is an intermediate. It's just a stopgap measure that's going to help restore the blood supply and all that. Now, here's what's going to happen. The fibroblasts, which have also come into this area, are going to secrete some fibers, and those fibers are going to make a scar that's going to help to bring the edges back together as much as possible. The macrophages are coming out and they're getting rid of all the dead cells and all the damaged stuff. And now, here is where we get these cells of the skin, this epithelial, is going to start dividing and trying to bridge the gap and make it like it never happened. So once it's finished, you can see that you can barely see anything from the outside, but underneath you still have scar tissue. This is going to be our permanent repair. The area when it matures is going to contract. However, there are some that are so wide that they have to be sutured or glued shut, or else they'll form a visible scar. A lot of people don't want that, especially if it's on their face. Okay, guys, that's everything. We got through the tissues. I'll see you in the skin videos next.